moving back and forth, and you're gonna press upwards. Same thing, we're just gonna lean back and then pulling our head back. Go up to the middle. Now I'm gonna go to the top of the neck, and you're just gonna tuck back this way. In this video, I'm gonna show you 7 of the best exercises to help relieve neck and arm nerve pain. And for some people, you may notice a change in as little as 3 minutes. Follow along and keep watching. Hi, I'm Dr. Paul Barnwell, a chiropractor here in Katy, Texas. If you're dealing with neck pain that travels into your shoulder, arm, or hand, or you're feeling tingling, numbness, burning down the arm, this video is for you. A lot of people try stretching their neck and doing random exercises, and that often makes things worse because the nerve itself hasn't been addressed properly. That's why we're going to approach this a little differently. This routine is designed to calm the irritated nerve first, then gradually decompress the neck, restore motion, and finally reinforce proper alignment and mechanics. When you do it in this order, symptoms, they're much more likely to settle down instead of flaring up. So here's how I recommend you go through this video. Follow the exercises in the exact sequence I show you. They progress from easier, lower risk movements to more advanced corrective ones. You have to monitor how your neck and arm symptoms are responding as you go. Always work within your comfort levels and only move on to the next exercise when you feel that you're ready. If one movement clearly reduces your arm pain or it brings symptoms back towards your neck, meaning coming up, make note of it and spend a little more time there. Just camp there for a little bit. These are the same types of progressions I use with patients dealing with neck and arm and nerve pain, and they're designed to be effective without forcing the neck or aggravating symptoms. Now, given that you're not actually here and you're there, you're going to have to monitor your own symptoms. So just follow that advice. Take it slow. It's better to take it slow and not end up with a, we don't want to take steps backwards. We want to go forwards. So let's get started. Okay, let's see if we can get your neck and arm pain to feel better. We're going to be walking through 7 different exercises. There's going to be some variations of these, so there might be more than 7 technically, but there's variations of the same thing. And so I want you to walk through this process and just make sure that if there's any pain, increase in pain, you don't want that. That's bad. So stop it immediately. If that's the case, we need to try something else. You don't want to make it worse, obviously, so don't do that. So the first one's going to be median nerve flossing. And nerve flossing is very, very popular, but the idea is that nerves don't stretch very well, or they don't like stretching a whole lot. They do stretch to some degree, thank goodness, as they travel through the muscles in here. But what they can do is they can actually slide. So for example, you see something like this, right? So we have this is like, imagine this is a nerve, okay? And as it travels through the different muscle layers, the different fascia between the foramen and the spine, it's going to move back and forth like so. Okay, I can only get it from one direction clearly, but like this. So when you get a disc injury or a neck injury and you start developing adhesions, you start developing inflammation, and then over time along the fascial lines, or just damage from, sitting on a desk all day or, dealing with kids, that sort of thing, you're going to end up developing little areas where it gets stuck. So the idea behind the nerve flossing is that it's going to loosen that up to remove all the tension or is any kind of extra tension that's on the nerve. And it's the best one to start with because it's easy. It's not generally going to hurt you. And you can do it over and over. So let me show you 2 different ways to do this. So we're going to be focusing on basically the median nerve pathway, which goes from the neck down into the hand. So if you have hand pain, numbness, any of that, it's going to be super helpful for you. So what you want to do is you want to move the entire nerve one direction and then move the entire nerve the other direction. We don't want to go this way. We want to move it this way. Okay. Wax on, wax off, right? So what you're going to do is palm up to the side. We're going to shorten the nerve, right? And we're going to just follow that shortening this way. Okay. See how I'm moving my head? You can even turn the head if you'd like. Just be careful if you got a disc issue. We're going to turn this way. Okay. And then we're going to go back this way. Okay. So imagine that nerve just floating in space here, moving back and forth. And we're literally just lubricating it back and forth. Just imagine it in there, just swimming. Okay. So here, back and forth, pretty easy. As long as it's not hurting, you can go as fast or as slow as you want. Okay, you can turn the head this way if you'd like. no big deal. I will show you also, you can use a towel. I didn't have a large towel here, so I'm gonna use a gown. And this is pretty cool. So what you're gonna do is, I'm just gonna hold it with this hand. I'm gonna put it on top of my head now. You guys can notice I'm follicularly challenged. I have no hair, so this will stick on my head. If you've got a lot of hair, it might slide back and forth, but you just have to try it. So we're gonna put this right here, and basically, let's see if I can get my hand right. So I don't know if you can see, but I'm here, so that way, and I can move it this way. But the nice thing is I can basically get in this extended position like this, and I can just pull that way. And if that's not very comfortable, we can always turn the hand to a more neutral position. Whatever's gonna get the nerve moving. There we go. And this is relevant for me because I actually had a disc that blew out right here. Got injured, blew it out. I was out of work for almost a year. So if you're dealing with this, I feel your pain. And the good news is I didn't have to have surgery because I did all the things that I'm teaching you how to do. So that's number one, that's the median nerve flossing. Number two is gonna be, we're gonna try, actually 2 and 3, we're gonna work on different types of tractioning the neck. And the idea here is that we're trying to remove as much tension from the disc or the bones around where the nerves are coming out. We want to remove as much tension off of that as possible. So I'm going to change the camera position here, and I'll show you how to do that. So when you're dealing with neck pain and disc-related issues that might be causing pain that's going down into the shoulder, into the arm, into the hands, or we call that radicular pain, meaning it's coming from a nerve root. One of the best things that you can do is actually tractioning the spine gently so that we can take pressure off of the disc and therefore taking pressure off of the nerve. This is going to reduce those symptoms, help you to heal faster. So in fact, it's such a great treatment that we have a machine in the office called cervical spinal decompression, where we measure the amount of poundage and the angle and all of that so that we can get specific, as close as we can to a specific disc level. And then we can oscillate that back and forth, bringing hydration to the disc so that our patients can get better faster along with their other treatment program. But for now, I'm going to show you a couple ways to do this by yourself. You can do it without any equipment at all, or you can do it with some very little household items, and then you can also buy some equipment. So the first one is to just use your hands. So when you're tractioning the spine, it doesn't really take a lot of force to be able to take pressure off of the nerve. Okay, so what you're gonna do is just use your hands. You're gonna find the back of your neck here. So we wanna find right here, these ridges that are right here. So this is the top of the neck. You have C1 here, right above that. There's a bone on the back of the skull called the occiput. That's the ridge. You're gonna follow that down and you'll find 2 bumps right there. So you're gonna put the hands right here. If you need to cover your ears, you can. And that's gonna be your contact point. So what you'll do is just sit up tall and you're gonna gently lean your head back into your hands and you're gonna press upwards. Now the goal here, since you're using your muscles, is that you want to make sure that the neck muscles themselves are as relaxed as possible. This one can be a little bit challenging because you're using muscles and you're trying to relax muscles at the same time. So it takes some coordination to do this correctly. And you're not going to be able to generate a whole lot of force considering you're the one who's both decompressing and grounding yourself at the same time. But if you don't have any equipment, it works great. One thing that you can use to help is just use a wall. So same thing, except we're going to get right here. We're going to put our hands, our elbows up against the wall, and we're just going to use that as like a counter force or a counter pressure. So instead of pushing yourself, into the ground, we're going to use some of that force and push it into the wall. And we just go down into our heels. Now you can do this for 10 seconds. Focus, make sure that there's no pain that's coming back or increasing. If there's not, then you can work that up to 30 seconds. And you can do that as many times as you want. You can go from 3 to 10, something like that. Anything more than that, you're probably not going to be doing a whole lot of good. There's some diminishing returns there. Realizing that some of you may also have back pain and you can't do the tractioning up against the wall, you can also just do it on a table like this. Now, you want something that's going to be easy for you to lean up against in terms of height. So a bed would be good, a couch if it's high enough. You want something for your knees. But we're going to do the same thing, elbows on the table, hands are going to be behind the head on the occipital ridge, and we're just going to lean back into our knees. Okay, there's that option. You can also get something like a towel. I don't have a towel here, so we're gonna use a gown. And we're gonna wrap this around here and just pull it up towards where we're pushing, so up. Hold it here, and we're gonna do the exact same thing. We're just gonna lean back. Doesn't take a whole lot of force. You're not trying to, rip your head off. You're just trying to get some gentle decompression. So let's move to the next one. I think you'll like it. Okay, so with neck, arm pain, disc pain, going down the arm, one of the things that we want to do is make sure that we're getting the lordosis, or the curvature, back in the neck, and we're working the muscles, and we're tractioning the spine. So one tool that I like to use for that is, this is called a prolordotic exerciser. It's literally a band with some foam on it. You can buy these online, or I'm going to show you a version that just uses a stretchy band and a towel. But the idea here is that we're going to be wrapping this around the back of our neck, okay? You can see this is at the base of the neck. The hands are going to be here, almost like you're boxing, right? So we don't want them here, we want them here. And then we're going to go in 3 directions. We're going to go down, we're going to go out, and we're going to go up like this. And all we're doing is holding our head neutral and then pulling our head back. Good. And then we go up to the middle. Good. Now I'm going to go to the top of the neck. Right here. Now we can do multiple passes, and we can do multiple in each section. So just like this. Awesome. So another way that you can do it is stretchy band. So this is like a pull-up band, okay, nice and sturdy. And we're gonna get a trusty hand towel here, and we're just gonna wrap it up. So you can see I'm just in the middle of the band here, and we're just gonna roll that. So now we have our own makeshift prolordotic exerciser. If this towel is too thick, then you just thin it out. So we're gonna go here. Good. Good. And this one's a little looser than the other one, so we're gonna come up, I'm gonna hold it closer to my head here. So if you don't have access to equipment, everybody generally will have access to some stretchy bands. And it's as simple as that. So there's one more option. Let me give you one more here, so stay tuned. So when you're dealing with neck pain, disc issues that are going down to the arms and to the hands, one of the best things that you can do is called a chin tuck. Now, if you search around the internet, you're gonna have all different varying opinions on whether this is a good thing or a bad thing to do. And the reason for that is because everybody's different. Everybody's in different stages of their recovery. If you have an extruded disc that's putting material into your spine, like, don't do chin tucks. It's not gonna help you. If you've got a bone spur that's sitting right on that nerve and doing that position is gonna stab the nerve, you're not gonna be able to do it. But if you understand the reason why you're doing it, and you're doing it correctly, then you can understand why it might be a good thing to do. So with the chin tuck, the idea here is that as you're pulling the head back this way, so you can see I'm basically giving myself a double chin, is that we're working these deep cervical muscles right here. So the ones on the front of the neck. So think about it like, just like we're trying to stabilize with low back pain, we're trying to stabilize the core. This is the core for your neck. So we have to make sure that it's strong. Now, all of it matters, okay? So we're not gonna focus on just one thing, but this is gonna be very important. So the easiest way to do it is just to sit up in your chair, and you're just gonna tuck back this way, okay? If there's any pain, don't do it. So we're gonna come back, probably a 2-second hold. 1, 2, 1, 2. Awesome. Now there's a lot of variety that you can do with this. It's, with this exercise, it's not a super sexy exercise, but it does work. So let's try it laying down. That way gravity treats us differently. So when we're here, we're gonna go here, and you're basically just going to pick the head up gently, and then we're gonna bring it back down, just like that, chin tuck. So I'm essentially rocking my head this way. Good. Even if you don't do the movement, just holding that position, you're gonna feel a lot of tension in the neck. That's because all of our necks are so weak now because we sit at desks all the time. You wanna turn this up a little bit. We're gonna stay in that position, and we're gonna do slow rotations. Be careful if you have a disc issue. Rotate, rotate. Good. Guess what? We can do the same thing side to side. So if you can't see what I'm doing here because I'm laying down, I've got my head off the table, just gently in the chin tuck position and going this way. Now I'll tell you what, you do this every day, your whole body feels stronger, because when your core, your spine is strong, that's the foundation of your health. And if it's not strong, you don't feel strong. It doesn't matter how big your biceps are or how strong your thighs are. If your foundation isn't strong, if you have a weak link anywhere in that system, you're not gonna feel strong. So let's get it as healthy as possible. Now I wanna show you one more bonus. This is a fun stretch. I saved this one for last because if you have disc issues, you have to be very careful doing a lot of neck stretches. So if we want to go to the side, we can do that. So if we're turning to this side, so this my right hand, if you're looking here, so this is going to go on the cheek. And if I want to get the back of the neck versus the front of the neck, the back of the neck, we're going to turn that head. So opposite hand, turn the head, and you're going to be pulling down. If you want to get the front of the neck, turn the head here, pull down on both sides, rather on your support hand here. This side is going to come up. Again, great stretch. Be careful if there's any disc damage that's in your spine. If you need help with any of this, leave some comments below. I'm happy to help. And of course, if you need any professional help, then you can always come in the office and see me. A pinched nerve in the neck that causes arm pain, numbness, tingling can be incredibly frustrating. I know because I've had it. It can make everyday things like working, driving, sleeping, or even using your phone uncomfortable. And if it continues to worsen, it can start to limit your function and your quality of life. And that's why it's so important to keep the neck moving well, reduce pressure on the nerves, and start addressing the problem early so it doesn't turn into something chronic. These exercises that I showed you in this video are designed to help calm the irritated nerves, take pressure off the neck, and restore better movement and alignment so daily activities feel easier and more comfortable. So if you found value in this video, please like it and share it so others who are dealing with neck and nerve pain can benefit from it as well. And in the comments below, let me know which exercise gave you the most relief. Was it the nerve flossing? Was it the traction with the towel or the table? Drop a comment and tell me. Be sure to subscribe if you want to better understand your body, reclaim your health, and get practical, actionable steps you can use right away to move towards a life with less pain and more purpose. And if you want a deeper understanding of the main cause of neck pain that shoots into the arm, the next video should be the one that you watch next. Go watch this video next.